at the 2010 OneMedForum in San Francisco. I'm now joined by Joseph Kim, CEO of Inovio Biomedical. Joseph, thank you very much for joining us.
Thank you very much for having me.
It's my pleasure. I think the best way to start is probably just a brief overview of Inovio.
Well, Inovio is devoted to developing a new generation of vaccines called DNA vaccines. So third generation of vaccines besides the live and attenuated viruses as vaccines. We have built a vertically integrated product development platform using the DNA vaccines to attack various targets, developing products against cancer, infectious diseases of major impact.
Let's talk about the difference between DNA vaccines and the vaccination process that they use currently.
Very good. The DNA vaccines, in contrast to the conventional vaccines, which uses the live or killed viruses as vaccines, we actually deliver the genetic blueprint for the vaccine targets in a very simplified form of DNA called plasmids. So when it's injected into the tissue, whether it's muscle or the skin, those tissues or cells start to manufacture your personalized and customized vaccines for your own body, and delivering and inducing the naturally occurring most potent immune responses to protect us from cancer or infectious disease.
Yep. Now, this platform, the SynCon platform, as
Right.
you just mentioned, can be used for both oncology as well
Right.
as infectious disease. When we talk just briefly about the oncology platform and technologies that you're working on now.
But SynCon really is pushing the envelope of the DNA vaccines as a technology. So instead of using a single genetic blueprint, we're actually collapsing down multiple blueprints into one, pulling out at each amino acid position the most common and potent amino acid, and then stringing them up together. In basic sense, what it does is it allows us to protect against a differing and broader set of viruses instead of a strain-specific things that the current vaccine manufacturers are doing.
Okay. So as far as on the infectious disease side, this means that now, uh, different from the traditional seasonal flu vaccine where they have to basically guess which strain is going to come through, you can now vaccinate for multiple types and cover all different seasonal flus.
Absolutely. So we have applied our SynCon approach to design and develop universal flu vaccine programs,
Okay.
where, for instance, our H5 and H1 DNA vaccine, SynCon vaccines, were able to protect against a different, broadly mutating strains of the virus. So, for instance, the vaccine that we designed in 2006, SynCon vaccine, was able to protect after a single shot against a 2009 H1N1 swine pandemic flu virus, which shows the power of this universal SynCon approach.
Yes. Let's talk briefly about the oncology different programs that we could use here,
Right.
specifically the cervical cancer program that you're working on
Right.
now.
Our lead advanced cancer program is a therapeutic vaccine for cervical cancer using our SynCon approach once again. In contrast to the preventative vaccines like Gardasil and Cervarix that's on the market, they work very well in preventing infection, but they're not effective in preventing the cancer from setting in women. So who are already infected with the virus. So what we're developing, it could be looked at as a sister vaccine program where our vaccine can seek out and destroy the tumor cells in women who are already infected with the virus.
I guess just as a brief overview here from an investor's standpoint,
Right.
what kind of major catalysts and milestones can we expect to see from Inovio in the remainder of 2010?
Right. I mean, we have an exciting set of pipeline and platform that we have built together in recent months, but we've been flying under the radar in the last to the Wall Street in the last few months. However, we have very exciting set of clinical milestones coming down the pipeline the next 6 to 12 months, including the completion of our phase 1 therapeutic cervical cancer vaccine program that I just told you about, including the initiation and the completion of our first set of the universal flu vaccine testing, which will start with the H5N1, and then we'll be adding the H1N1 portion of that as well. And lastly, our HIV vaccine, both preventative and therapeutic vaccine programs should all be finished in the next 12 to 18 months.
Joseph, thank you very much for joining us.
Thank you, Bill.
Again, that was Inovio Biomedical. For more information, you can visit them online at inovio.com. They trade under the symbol INO, and information can also be found at OneMedPlace.com.